Good afternoon, everyone. I'm Ruth Rai, and my presentation is on topic radiation therapy mid-surge. For introduction, we must all know that radiation has been an effective tool for treating cancer for more than 100 years. That means for more than about 100 years, cancer patient has been treated through radiation therapy. Radiation oncologists are doctors trained to use radiation to eradicate cancer. That means to destroy cancer. About two-thirds of all cancer patients will receive radiation therapy as a part of their treatment. For definition, what is radiation therapy? Radiation therapy is also called as radiotherapy, extrotherapy, or irradiation. While this therapy is done by the use of ionizing radiation or energy, which helps to kill cancer cells and shrink tumors. So, what is ionizing radiation? Ionizing radiation is X-ray gamma rays that consist of particles, either alpha particles, beta particles, or neutron particles. So, what this second paragraph means is that radiation therapy will make it impossible for the cancer cells to continue to reproduce, grow, or divide in the area being treated, as in that area radiation will destroy all the cells and damage its genetic material like DNA of cancer cells, which will prevent from further reproduction or growth of cancer cells. And then we have radiation therapy team. Radiation therapy team are the healthcare provider who will give radiation treatment to the patient. Number one, we have radiation oncologists or doctors. They'll specialize in using the radiation to treat cancer. And then we have dosimetrists. They will determine the proper radiation dose. And we have radiation physicists. They'll make sure that the machine delivers the right amount of radiation in the correct site in the body. And then we have radiation therapists. They'll give the radiation therapy to the cancer patient. And there you have indications for radiation therapy. We all know that the goal of radiation therapy is to destroy cancer cells while maintaining the integrity of normal tissues. Number one, we have curative or radical radiation therapy. Here, radiation is used with an intention to eradicate the tumor or to eliminate all signs of cancer, which means during this therapy, radiation is used to destroy tumor or eliminate signs of cancer. Palliative radiation therapy. This therapy is used to reduce pain from bony metastasis, relieve obstruction of GI, respiratory, or urinary system, prevent bleeding, or paralysis of spinal cord compression. And then we have number three, adjuvant radiation therapy, used in combination with other treatment methods to improve survival and reduce risk of tumor recurrence, which means this therapy is combined with other methods of treatment to improve patient survival and to reduce the risk of tumor recurrence. And four, we have paraphyletic radiation therapy. In some types of cancer, radiation may be given to areas that do not have evidence of cancer. It is done to prevent cancer from growing in the areas receiving the radiation, which means this therapy is done just to prevent the spread of cancer and in the area where the cancer is not spreaded yet. That means this paraphyletic radiation is done just to prevent the spread of cancer. Types of radiation therapy. There are two types of radiation therapy. Number one is external radiation therapy, and number two is internal radiation therapy. So I'll just explain it in brief without going through the notes. You can go it later. Number one is external radiation therapy. It is also called as teletherapy. This therapy is done externally at a certain distance from the specific area of a body. It is mostly used to treat cancer of bladder, brain, larynx, lungs, vagina, etc. It helps to relieve pain when the cancer spreads to the other part of the body. And then we have internal radiation therapy. So, internal radiation therapy is also called as brachytherapy or brachytherapy. This therapy is done directly into or near the tumor. The radiation source is usually sealed in small holder called an implant. So, what is implant? An implant may be in the form of thin wires, plastic tube catheter, ribbons, or capsules. This internal therapy is used to treat cancer of head, neck, breast, uterus, thyroid, cervix, prostate, etc. Well, patient can receive both the external and internal therapy at the same time. And then we have radiation safety. Radiation safety. Radiation exposure to staff and patient is highly regulated and monitored process. Essentially, there is no radiation exposure to the staff when patients are treated with external beam linear accelerator machine. It does not turn on before the treatment room door is closed and the staff has left the room, which means while during the radiation therapy, except for the patient, everyone must leave the room as the radiation or the rays might hit the person. The most important factor in radiation safety are time, shielding, and number three is distance. This is lead shielding, which can provide additional safety for radiation, and it is used during the X-ray. Okay, and then we have side effects of radiation therapy. Most common side effects, number one, we have skin reaction or skin irritation in the area of the body where being treated. The patient might have redness or dryness or too severe peeling. So, to prevent this, we should keep the area dry and free from irritation. Wash the skin in area treat only with mild soaps. Use mild shampoo such as baby shampoo. When using towel, pat the treated area dry instead of rubbing it. And then we should use electric razor just to save in order to prevent cuts. Avoid using shaving lotion or scented creams. Do not use perfumes, deodorants, makeups on the treated area. Avoid using heated pad or ice packs on treated area, etc., etc., etc. And then we have fatigue. After the radiation therapy, the patient might feel tired, weakness, exhaustion, or profound lack of energy. It is more severe 2 to 4 hours after treatment. So, the following suggestion will help to manage fatigue resulting from radiation therapy. Limit your activities if possible. Exercise each day to maintain strength. Number three is prepare meals ahead of time and freeze them. Use convenience food that are ready to eat. Excuse me. Accept offers of help from friends and relatives. Drink 3 quarts of water fluid each day. Increase rest by getting more sleep and taking naps. Try to eat even when you are tired because food increases energy. And another, we have side effects associated with RT or radiation therapy to head and neck. Number one, we have mucositis. Also easier to know, sore mouth or sore throat. It is the inflammation on the outer lining of the mouth and throat. When the radiation is directly administered near or to head and neck, chest, abdomen, or anorectal region, it causes damages to the mucosal cells, causing pain and infection. So, to avoid this, suggestions are choose soft foods that are easy to chew and swallow, avoid food that irritates mouth like citrus food, and foods that are spicy, salty, raw, coarse, or dry. Foods, cook foods until they are soft and tender. Cut foods into small pieces. Use straw to drink liquid, etc., etc. xerostomia or dry mouth. Radiation therapy is delivered to head and neck may result in xerostomia. What is xerostomia? It is a chronic dry mouth condition. So, to cope with dry mouth, here are the tips. Try consuming sweet or tart food, beverages such as lemonade to help your mouth produce saliva. Keep lips moist with lips salve or lip balms. Where did it go? Soak on sugar free hard candy or popsicles or sugar free gums to help produce saliva. Eat soft food that are easy to swallow, etc. You can go through it later. Change sense of taste and smells. So, radiation therapy or cancer itself may cause a change of taste or smells that typically goes away once treatment is complete. So, suggestions are stop eating food that cause an unpleasant taste, choose food that look good and smell good to you, serve food at home or serve food at room temperature, try using small amount of flavorful seasoning, etc. Less common side effects of radiation therapy. So, what are the less side effects? Are number one, hair loss or alopecia. Radiation therapy can cause hair loss after being treated within 2 to 4 weeks. Some may experience thinning of hair while others may experience complete hair loss. Hair loss is temporary, regrowth begins after 6 to 8 weeks of completion of radiation therapy. So, the tips are given for this below. You can go through it later. And then we have nausea or vomiting. Sometimes radiation therapy may cause nausea and vomiting, especially when radiation is delivered in the stomach area. FDA have approved several drugs called antiemetics or antiemetics for the prevention of nausea and vomiting. So notes are given. Another we have number 3, diarrhea. Diarrhea is a loose stool pass. Radiation treatment that is delivered to abdominal or stomach area can cause diarrhea, which usually begins 3rd to 4th week of therapy. So tips are given for these two. Loss of appetite. Nausea, vomiting, and depression can contribute to loss of appetite. So the patient should follow the given nutritional intake. Number 5, we have low blood count or myelosuppression. Myelosuppression is also called as low blood count. Number of blood count or blood cell in circulation can be affected by radiation therapy. Low blood count may cause changes in sleep or rest pattern during therapy. Some patients describe sense of tiredness or fatigue. And then we have possible side effect with radiation to the chest. Number 1 is lung fibrosis or fibrosis. It is the scarring of lung tissue that causes difficulty in breathing. So lung fibrosis is the difficulty of breathing due to scarring of lung tissue. Fibrosis can be long-term complication after treatment to Hodgkin lymphoma and other cancer requiring therapy to the lungs. However, this disease in lung function appears to improve over time and is thought to reversible.